Women have covert assistance in the management of motherhood that is denied to men. Physically, the differences between the genders is obvious, but there are important biochemical differences too. Chief of these are the female sex hormones, in particular estrogens. During reproductive life, they have profound effects on both the body and the mind. They control the cyclical changes in the uterus. In the absence of conception, the lining is shed once a month in menstruation, which inevitably causes varying degrees of discomfort. Women are rarely at their best at this time, and in some cultures they retire from society for a few days. A few days prior to menstruation, the estrogen level falls, giving rise to both physical and psychological symptoms. It has been reported that some 10% of women complain of feeling depressed, anxious, and irritable in the days leading up to a period. It is possible that in fact all women experience these sensations, but that most are too preoccupied by everyday life to notice. Clinically, this is called premenstrual tension, or PMT. To men, PMT is something of a mystery, but I suspect that the symptoms are more serious than generally realized. Thanks to the advent of power steering and automatic gearboxes, many bus drivers nowadays are women. When my driving license was taken away, following conviction for the possession of the cannabis that I was researching, I was obliged to use public transport. I could not help noticing that at times some of these women were surly and offhand as they collected the fare. Moreover, the bus was often erratically driven, sometimes bumping over the curb on tight corners. At other times, the female drivers were charming, and the standard of driving was possibly better than that of men. On one occasion, a year or two later, after I had had my license restored, I was driving up a road near to a bus terminus in a local village. An empty bus, having dropped off the last passenger, came careering down the slope in the middle of the road at the end of its journey. It forced me to pull up, even though parked cars on the offside gave me the right of way. As the bus flashed past, I glimpsed a female driver with a seriously dishevelled psyche etched into her face and diagnosed premenstrual tension. It made me wonder whether women were temperamentally suited to driving vehicles. The stress of premenstrual tension is not a good time to be landing a jumbo jet, for example, or performing a surgical operation. Indeed, a couple of fraught visits to the barber, who all seem to be ladettes nowadays, caused me to wonder whether we're even up to trimming hair. Sadly, gender politics take precedence over both science and courtesy. It is unlikely that the presence or absence of premenstrual tension is considered as a factor in road accidents and insurance claims, for example. But it seems possible that it is women driving at this phase in their menstrual cycle that has given rise over the years to apocryphal aspersions about lady drivers. What the medical profession has failed to observe is that anxiety, depression, and irritability are typical of mild opiate withdrawal. They resemble the symptoms that follow a short course of painkillers for backache, for example, as mentioned in an earlier video. I also noticed them myself a day or two after my self-administration experiments with opiates. Interestingly, although the effects of many psychotropic substances are difficult to articulate in words, the subjective sensation of opiate intoxication can be described as feeling cradled in a mother's arms. It seems possible, therefore, that in addition to the physical effects on the reproductive tract, estrogens stimulate the body's own opiates. It is this effect that must lay at the root of the aura of maternal warmth, with its reassuring tranquility, kindness and understanding that emanates from good mothers. It makes them addictively lovable creatures. It is this characteristic, rather than physical endowment, that makes women beautiful. It accounts for the fact that any woman can attract a mate, so long as that she has a kind, sympathetic, maternal personality. In the final analysis, it is the way a woman handles her hormones that determines her character.